On today's podcast, we have the pleasure of introducing South Beach Symposium's co-chairs, Dr. Michael Gold and Dr. David Goldberg. We would like to ask them a couple of questions regarding our theme this year about more than what meets the eye. So Dr. Gold, we are focusing on this more than what meets the eye theme with our South Beach meeting happening in February, and seeing as to how you direct and chair the popular live patient device demo session at South Beach every year. You're very well known in the aesthetic and cosmetic dermatology space. Could you share with us what we don't know about you or your day-to-day practice?
Sure. So it's my pleasure to be here, and thank you for letting us have this forum. I think people, I think both of us are going to say similar things. We both are known in the space of dermatology as cosmetic dermatologists, which I think is great. But I think in reality, we're dermatologists. And, our practices, mine in particular, is a very busy medical and cosmetic dermatology practice. So we see everything that comes across the medical dermatology world every day, whether it's acne, eczema, psoriasis, warts, skin cancers, the gamut of rashes that everybody sees. And the other thing that is important for people to know is that we both have pretty large clinical research centers where we do lots of FDA clinical trials on the med derm side as well as the cosmetic side. So I think it's people know us as cosmetic dermatologists, but I think we are dermatologists, and we bring to the equation that we're able to discuss every aspect of dermatology, whether it's whether it's the bread and butter acne, eczema, psoriasis, skin cancer world, or it's the more aesthetic versions that we're used to seeing. So we do it all, and that's what makes dermatology fun. And I'll turn it over to David.
Thanks, Michael. I think what Michael said is true. There often is a difference between how we are perceived on the lecture circuit and yet what we deal with in our everyday lives. Both of us some 30 years ago got on the lecture circuit, first in the laser arena and then in the aesthetic arena, and that sort of picks up and continues on like that. But that's not necessarily what we do every day. I have, of course, had the honor of running the Cutaneous Oncology section for South Beach Symposium now for several years already. I've trained fellows to do Mohs surgery, now running programs everywhere from Harvard to Emory to Mount Sinai to Einstein in New York. And in fact, my practice is probably 65% medical dermatology and 35% aesthetic dermatology, despite what I do on the lecture circuit. And in that arena, as Dr. Gold said, it's everything from acne to eczema to psoriasis to cutaneous oncology. And our research programs are similar. We certainly do aesthetic research programs, but the majority of the studies we do are in medical dermatology. So, biologics for everything from atopic dermatitis, prurigo nodularis, xerosis, new treatments for cutaneous squamous cell carcinoma and basal cell carcinoma. And so it's like I said, there is this disparity between the way we're perceived on the lecture circuit and what we do in our real lives. And our real lives really cover every aspect of dermatology, and both of us look forward to bringing that to South Beach Symposium.
Thank you both. And yes, I was actually, our next question, I was going to share that you were the chair of our Cutaneous Oncology Track, and you are a Mohs surgeon. So, it's very interesting to hear the split of your practice. I know that both of you are involved in some really important clinical trials. Could you share a little bit about your focus there?
So I'll go first on this one.
Sure.
I'll go first. So first of all, atopic dermatitis, is a condition that we have obviously treated forever. And historically, it's been a variety of topical agents. And then one product came on the market as a biologic several years ago. That area is exploding now as we're understanding the pathways for so many different skin diseases. And as we understand those pathways, we've developed new treatments that are going to revolutionize the change the treatment of anything from atopic dermatitis to a variety of dermatoses that involve various different immune processes. The same thing was applied to skin cancer, and frankly, we even have new treatments for acne as well. So that whole arena is really very exciting right now.
Yeah, and I'll just echo what David said. I mean, there are I call them the TV medicine. So whenever you turn on television in today's world, every other commercial is about a dermatology medicine. And the fascinating and exciting part of that is we're only seeing on television what's already FDA approved. There are lots and lots of medicines that are being studied for all of these indications, whether it's psoriasis, atopic dermatitis, vitiligo, alopecia areata, hidradenitis. And we are part of almost all of those clinical trials on the MedDerm side. So that is really exciting to be able to see the evolution of our therapies over the last 10 years and what's coming, and to be part of that research. So yeah, we do all of those trials like David does. And that's the exciting part of the MedDerm world that we live in. There are so many new molecules out there that are being studied, and to be part of it is very exciting.
Absolutely. And thank you, Dr. Gold, for bringing up the commercials. I think that's definitely something that our audience sees, obviously consumers see, all of your patients see. And I think it's really important because those companies that are in these trials and that are getting these drugs approved, they are, they have a task force, and they're at our meetings. They're there to answer questions from, all of the physicians that are in attendance. So that's all a part of South Beach. And for our last question, I kind of wanted to touch on the actual South Beach meeting, since both of you have been involved for so many years and you've seen quite the evolution, I'm sure, in the last 21 years. What would you say has changed in the last 21 years with regard to medical dermatology at the SBS meeting?
So as I look at medical dermatology, and I'm going to go before the 21 years of South Beach Symposium, when I first made a decision 35 years ago to go into dermatology, peers of mine said, why would you ever choose to practice in such a boring area of medicine? Dermatology was boring. Certainly, it has not been boring, and we've seen that evolution over the course of 20 years in South Beach Symposium. But I think it's fair to say now, particularly in the medical dermatology arena, this is the most exciting area of medicine, and it's all going to be at South Beach Symposium in February, and I'm excited to be a part of it.
As I am. I mean, to watch South Beach grow over the last 20 plus years has been really exciting for all of us. This little, what I would call local / regional, now national meeting has grown up and matured, and the faculty is amazing. And yet we cover every aspect of what's important today. So on the medical side, we cover all the diseases we talked about. And then on the cosmetic side, we bring the latest techniques and treatments that are out there to the audience to be able to take back to their patients. So there's so much to learn. There's really there's just an amazing amount of education to be had at South Beach. And as David said, we're both excited to be part of it, and we can't wait to see everybody in February in Miami.
Well, we really appreciate it and appreciate what you both have done with the meeting, and kind of sharing your pearls every year and directing the sessions and, assisting in faculty selection, because that's, as chairs, that's what you do. You help us with our agenda, our program, and with the amazing faculty that are a part of South Beach. So we're very excited to have you both as co-chairs this year. And the sky's the limit, really. We're very excited for February 9th. And hope that both of you have a good rest of your day.
All right, we'll see you all very soon. Take care.
Thank you.
Take care. Bye-bye.
Bye-bye.